The Synthase Oracle Spacer System is a comprehensive set of instruments and implants designed to support a minimally invasive, direct lateral approach to the lumbar spine. This approach avoids the anterior vessels, posterior bony structures, neural elements, and allows the anterior and posterior longitudinal ligaments to remain intact. The Oracle Spacer is indicated for use in patients with degenerative disc disease at 1 or 2 contiguous levels from L2 to S1, whose condition requires the use of interbody fusion combined with supplemental fixation. The interior of the Oracle Spacer should be packed with autogeneous bone graft, for example, autograft. The neurophysiologist or neuromonitoring technician should apply all appropriate electrodes to the patient prior to positioning. Place the patient in a lateral decubitus position. Place a bolster underneath the hip to aid in opening the space between the 12th rib and iliac crest. This can also be done by flexing the table. Secure the patient to the table. Use caution to prevent undue pressure points when positioning and securing the patient. Incise the skin. Take the subcutaneous tissue down to expose the oblique muscles of the abdomen. Separate the muscle fibers using blunt dissection and enter the retroperitoneal space. Move the peritoneum anterior with the forefinger and continue blunt dissection. Palpate down to the transverse process. Slide forward to the psoas muscle. With the help of the neuromonitoring expert, establish a safe corridor through the psoas with a monopolar stimulating probe and fluoroscopy. Push the probe into the desired disc space. Use lateral fluoroscopy to determine the probe's location. Remove the handle and cable from the probe. Slide the small adjacent dilator anteriorly over the probe and push firmly into the disc space. Slide the large adjacent dilator anteriorly over the small adjacent dilator and probe. Use fluoroscopy to verify that each adjacent dilator has fully passed through the psoas and into the disc space. Slide the retractor over the adjacent dilators and probe. Use AP fluoroscopy to determine the position of the retractor blade tips. Push down firmly on the retractor blades to ensure contact with the disc and/or vertebral end plates, and maintain a perpendicular exposure to the disc space. Remove the adjacent dilators. Keep the probe in position as a point of reference and gently open the retractor to the desired position. Lock the retractor in place by turning the speed nut. Use the universal arm and table clamp to stabilize the retractor to the OR table. Gently retract the third blade posteriorly by turning the knob clockwise with the socket wrench. With the blades open and secure, slide the light clip onto either the cranial or caudal blades of the retractor. For further retraction, the cranial and caudal blades can independently provide up to 15 degrees of angulation. When the desired angulation is achieved, remove the probe. For increased retractor stability, attach the intradiscal anchor to the third blade by screwing the anchor onto the extension driver and sliding the anchor down the grooves of the third blade. Remove the disc material from the intervertebral space using any of the following: end plate elevator, cup and ring curettes, rongeurs or shavers. To prepare the end plates, remove the superficial cartilaginous layers with a rasp and expose bleeding bone. Connect an appropriately sized trial spacer to the handle. Insert the trial spacer into the disc space, ensuring that the orientation of the lordotic trial spacer is correct. Controlled and light hammering on the trial spacer may be required to advance the trial spacer into the intervertebral disc space. Use fluoroscopy to confirm the fit of the trial spacer. The center opening should align with the spinous processes on an AP fluoroscopic view. Remove the trial spacer using the Oracle slap hammer. Be sure to hold down the retractor while removing the trial spacer. Insert the auricle implant using the auricle lateral quick inserter distractor, squid. Pack the interior of the implant with autologous bone. Place the implant into the rails, ensuring the implant is securely seated into the pusher. With the squid loaded, place the distal end of the paddles in the desired disc space. Under fluoroscopy, make sure the stops on the paddles are contacting the vertebral bodies. Apply a firm downward force to keep the squid on the spine. Apply a firm and stationary force on the grip with one hand, and turn the T-handle clockwise with the other to advance the implant down the rails and into the disc space. Use fluoroscopy to verify the implant's progression and the location of the depth stops on the vertebral bodies. Remove the squid. Use the auricle impactor to seat the implant into its desired position.